Right. Well, we've got 19 of us. Excuse me. So if Robin and Ryan, whenever they're ready, they can get going. And as people trickle in, I'll let them in. Similarly, if you get booted or have to leave, just get back in the waiting room and I'll keep an eye on it and let you back in. Again, good morning. Welcome.
Yeah,
oh, I hear people.
Hi, everyone. Sorry, we're working on it. We're having a little problem with the
volume.
Yeah, with finding volume on our setup in the Zoom room here. So we are
no problem.
doing our best there. For the moment,
not a problem at all.
Computer.
I was gonna say, so we're with the Montana Public Health Training Center. This is our grant writing webinar. FYI, we have a longer workshop, like online series coming up with these same two wonderful trainers. So if you want more in-depth and more information, please check out the website and that'll be coming up. So if you need even more grant writing work, I think we all do. So again, we'll have an evaluation at the end that we'll send out. Again, feel free to keep visiting our website. I hope you find other trainings on there that are useful. Me and Alexis today, you see her waving there. She's my co-lead here at the center, and we'll be managing the chat box. So if you guys have questions, instead of interrupting, you just throw it in the chat box. We'll make sure that Robin or Ryan sees it. And make sure it gets answered. You also have the option, if you look at your participant list, to raise your hand. So that's a nice way to indicate as well. Again, you can keep your video on. We like to see faces. If you have any bandwidth issues, you can shut it off though. And I think that's all I've got. Anything else, Alexis?
No, just welcome. Thank you so much for taking the time this morning to be with us.
All right. And then, yeah, Robin and Ryan, whenever you're ready.
Okay. Yeah.
Oh, we've got our dueling computer thing again.
Yeah.
Okay, got it in?
Yep.
That's fine. Turn your volume off.
Oh, technology.
All right, I hope everyone can hear us and there's no issues. We are trying to figure out a volume issue on our end, but we'll get it figured out as time goes on here. I'm going to also ask everyone to introduce themselves if they would in the chat box. So we're going to send something here out from Ryan and Ryan. I'm going to Ryan and Robin. That's how disoriented I am this morning. Ryan and Robin here in Missoula. And we are with the University of Montana Center for Children, Families, and Workforce Development. We are within the same college as the training center. We have been sort of doing what we've been doing, working with children and families across the state of Montana for the last, gosh, it's probably been now 3 years that the center's been operating, but prior to that, it was a smaller center that was in operation for about 20 years. And so we've kind of expanded over that time as we look at figuring out what it is that we do for the state of Montana as it applies to children and families. So we do research, we do a lot of work with data, we do a lot of work with training in social services, K-12, hospitals, folks that are working in public health, all the different systems that are working with children and families. So we're trying to figure out what is it that we can do in order to address some of the needs that the folks in Montana are facing that are a little bit more high risk in terms of what kinds of needs they might need to have addressed and in order to better serve these populations, again, across the state of Montana. So we're in schools in Broadus and in Miles City, and social services in Wolf Point and Havre and Dillon and all over the entire state. So we do work along those lines, and another area that we have been involved with has been with respect to sort of developing capacity for organizations and systems across the state of Montana. So we, as we talk about grant writing today, we received a grant. We have about 13 to 15 different grants and contracts that we operate with right now. And one of them has to do with putting in a grant saying, what we would like to do is we would like to build the capacity of local public and nonprofit organizations in order to make sure that we can help build their capacity. So what's happened in the state of Montana has been that it's kind of been a situation where a lot of the urban areas have had better access to some of those resources and some of those grants, and some of the smaller communities have had lesser access. And so this has been a great divide between urban and rural areas of Montana that's really limited the opportunities for some of those other communities to be able to access some of those resources that are available through grants and contracts that are out there. So we said we want money to create more revenue, more resources, more funding for the state of Montana so that additional dollars can be brought in order to assist those folks in trying to figure out, all right, we got an idea, we've got a problem trying to address here in our community. What do we do? How do we move forward? And we said, well, we'd like to help them figure out how to put those grants together, do training, and provide resources in whatever way we can in order to ensure that we can help build that capacity to solve those problems in local communities. So there'll be 3 of us that will assist in that process today in this training. Again, my name is Ryan. I've been at the University of Montana for 25 years. I've been teaching grant writing during that whole time. I've been also in a situation where I have, all right, I'm looking at different screens here.
I just did this, sorry. Do you want me to undo that?
I don't know, do whichever you want to do, I guess. and I've been with the University of Montana for 25 years, teaching grant writing, organizational leadership during that time period, and also have written, I was guessing like maybe 50 grants, and probably have read thousands of grants. I've been on both sides with regard to submitting proposals in order to receive funding, and primarily that money that I brought in is for the state of Montana. And I've also been in a position where I've been in a reviewer position and reviewing grants to see what should get funded. And I also have been a part of a foundation reviewing grants and sending money out and setting up the entire process to figure out how to distribute funding then to people across the state of Montana. So I've done it in a number of different areas in order to figure out how to, again, bring resources to the state. And I'm going to let Kate introduce herself really quick and then come back and have Rob introduce herself too.
Yeah, hello and good morning, everyone. My name is Kate Chapin, and I currently serve as a project evaluator for the Center for Children, Families, and Workforce Development, and have been involved in the grant writing, grant seeking process in a variety of ways. Was a grant manager for a small nonprofit in town. And I'm excited to be here and to help facilitate. Pass it back to you, Ryan. Okay.
Hi, everyone. I am Robin Nielsen-Cercone, and I work here at the center with Ryan, and I work on the grants program primarily. I'm kind of the matchmaker.
Oh, we've got that wobbly audio thing going again.
Can you hear? Oh, can you hear me?
Okay, that's working on putting together people who need grants, especially rurals, with potential help in getting set up to write a grant, or with help from grant writers, help to find the kind of grants you need to fund the kind of programs you're working on. I started the program, I guess, last fall. I mean, it was underway, but it's been expanded starting last fall. So I'd love to have you reach out to me after the training and tell me what kinds of things you are interested in doing, and see if there's a way the center can help.
All right, so one of the things no, don't worry about that, just keep it muted. All right, so one of the things I wanted to go over before we get started here is just kind of a discussion around grants and around putting grants together and that whole process. One of the things in Montana that we've unfortunately gotten ourselves into a situation where it's been seen as somewhat competitive and competing against others in the state in order to get a limited amount of funding. And so that oftentimes puts us in a position where we're competing against one another for a limited amount of money, and like the best grant proposal rises to the top, and then somebody else doesn't get it, and those that receive it are very happy, those that don't are back to the drawing board after putting a lot of time and energy into a proposal that didn't get funded, that can be sort of trying and difficult when that happens. So what we want to speak a little bit about is figuring out how we can help all of you maximize your likelihood of receiving funding rather than having one group receive it and another group not receive it. We want to increase likelihood that everyone can be successful in moving forward. So in doing that, we're going to talk a little bit about funding sources, whether it be at foundation, federal, state, local levels. It may be small foundations that exist in your communities, and maybe donors of types. There may be ways to figure out how to bring, especially if you're in a rural area, organize yourself in sort of a collaborative so that you've got an opportunity to make yourself stronger. So if you're a small community, small county, I see Granite Health here. I'm back and forth to Petersburg area all the time, Anaconda. Sometimes being that small of a county makes you appear to have less strength, and it may be advantageous to figure out how to regionalize yourself and join with others in that area and put together sort of a collaborative grant that is sort of team-based, and all of a sudden you've got a stronger point to apply from. So we're going to talk a lot about different strategies and ways to maximize that, in addition to how is it that you go through each of these different sections as a way to put these grants together in order to be as competitive as you can be moving forward. I've also been involved both the state recently and I guess federal, state, and foundation level. And I think they're understanding better and better that it shouldn't be necessarily the best grant writer and the best written grant wins, that it should be where the need is the greatest. So they're seeing that, and I think this has to do with a lot of members of congressional parties, it could be Republican or Democrat, that are saying we've got a big problem here because we are not getting our fair share of grant funding that may be available at the federal level or even distributed in the state, because the urban areas are out competing some of those. So how is it that we can make sure that we've got the same kind of access as others have moving forward? So I think that there's I think more emphasis now on figuring out where those problems exist and knowing that we haven't done well in certain sectors and we need to do better. And I think we're moving in a positive direction as it applies to that. So over the next 4 hours, we're going to be covering information along those lines. Again, dividing into different groups, as having an opportunity to talk in small groups about how to go about doing that. We have 4 hours, so that's a long time to be at a Zoom call looking at your computer. So hopefully you're able to give us most of your attention as you sort of multitask here a little bit, whether it be chat room or going into groups that will divide you into, and paying attention to where we're going and what we're doing. Now, as we do this, I want to also make sure that feel free to chat as often as possible with any questions that you might have. So if I mentioned I'm going to speak to different acronyms. So I'm going to use RFA and RFP, request for proposals or request for applications. So I'm going to use these different acronyms, and I'm going to use other ones too. Please put in the chat room, I have no idea what RFA or RFP is, can you please explain? So I know I will do it, and the more that you can throw those questions up there, the more that we can make sure that everybody's on the same page and understands what I'm talking about when I go into some of that language that may be different from public health, social services, higher ed, K-12. And so please feel free to comment anytime in order to make sure that we're all on the same page. So questions, any questions that you have, please make sure that you put those forward as we move through this. I'm going to try to break this down as basically as we can so that it's as non-confusing and make it as non-complex as we can. But there may be times that you might not understand, and I know that some of you have different levels of grant writing experience as we got some of these assessments in. It indicated that there were some folks that have done this a little bit, some that are just kind of warming up to this. And so we want to have opportunity to make sure that everyone has a chance to kind of learn from one another. So although we've got experience doing this, many of you have other experiences too we want to make sure that we discuss as well. So any questions that you bring in, we would love to discuss, and anything you want to challenge, say, well, this won't work here where I'm at, and here's the reason why, please let us know, so that we can make sure that we think through that, discuss that, and have a chance to get you some information that could be helpful moving forward. Anything else that you want to add, Robin?
No, that gets us started.
Okay,
Do you want me to
Kate?
share screen and roll into?
Yeah, do we have this,
I can
this
share.
screen for something? Maybe, right. Kate, anything else you want to add?
No, that's great.
Okay, here we go. Okay, so I'm going to just start with something simple here before we start talking about all of the wonderful areas that everyone's involved with when you think about your community health assessments. And we're always going to be looking at problems related to, in the state of Montana, I see the people from the state of Colorado as well. We talk about problems related to suicide, diabetes, obesity, could be alcoholism, mental health problems. Before we get into those, and we will, I want to just sort of introduce a problem that's hopefully a little bit simpler than that. And just to get everybody warmed up, since it's 8 o'clock in the morning, to start thinking a little bit around problem solving and how do you do problem solving and figure out how to solve it, and then what sorts of issues you're needing to pay attention to in order to make sure that you address the sections that you are required to complete in any kind of a grant proposal. So I'm just going to use this as an example, and this one would be something that would apply to, again, diabetes, obesity, it could be cancer. There's lots of different ways that this problem could also apply to a number of other areas that may be of concern for you. So in this particular situation, what we have, and I'm going to be like from a school official standpoint, we've got a report that kids who are riding bus arrive at school cold, wet, and shivering. All right. Teachers have a hard time getting kids warmed up. Kids are distracted from learning. We also have some health-related complaints that have to do with aggravated asthma and kids having, again, learning problems because they're so cold when they arrive to school in the morning. And the kids are telling everyone that the windows are down while they're riding the bus to school. All right. So at this particular level, we have at least some initial information about this particular problem from a number of different sources. And so a lot of you will also have the same kind of information that you might receive, and based on those stories that you hear, information that you obtain, and other data that you collect, and we're going to use the word data a lot in terms of all the information sources that you might have as ways to collect information, that you've got some idea of what this problem is all about. All right, so we're learning about this problem in some way. Now, it could be that a lot of times leaders do this. We say, all right, we're going to go ahead and solve this problem. We don't want these kids to be shivering. We don't want this to be an issue or concern. So we're going to go ahead and make sure that we fix these bus heaters. We're going to close the windows. All right. So this is going to be a simple solution to this problem. But oftentimes what this is kind of a premature response because we don't really understand the nature of the problem. So what we're learning about are symptoms of the problem. We're not understanding the core of the problem or the root of the problem. So we have to dig a little deeper to learn about this problem a little bit more. So whenever you're then proposing a solution to a problem that you're seeing in your own community, if you're just dealing with symptoms, then that problem is going to continue to perpetuate because of the fact that you haven't identified the origin of that problem. So what we want to do is we want to dig a little deeper here and learn about what this problem is all about. Like, why are the windows down when these kids are riding the bus to school in the morning? It's cold out. This makes no sense. So we're going to need to expand our assessment of this situation and talk to more people. So in trying to figure out, again, and understand this problem, we're going to have to do some kind of an assessment, all right? Now, whenever you're putting a grant proposal together, there are sort of multiple levels of expectations around what that assessment's going to look like. So there may be times where they say, you need to do a needs assessment that's fairly elaborate, that involves surveys. You got to go out and talk to key informants. You've got to make sure that you talk to professionals and experts in the field. You have to get national data that you bring in, national information. It may be state level data that you might have to collect. kids count data or something along those lines, all these different data sources that may be required. In this particular situation, as we start to learn more about the problem, we might just ask, again, key informants or people that we know that are from the school or parents or bus drivers to learn more about this situation. All right, so we're going to expand our understanding of this problem. So let's say we decide, all right, we hear about this problem, we're going to start talking to school officials, we're going to talk to teachers to learn a little bit more, and we're going to talk to these bus drivers and ask them why the heck the windows are down in the morning and these kids are shivering cold and what have you. So dig a little deeper, we're going to drill down, we're going to try to identify the origin of this problem so that we can then make sure that we're not putting together an intervention or a program that's going to address the symptoms, okay? So then we may learn a little bit more and say, all right, what we understand is that it's not, you'll hear this all the time, all the buses, all the kids, everyone's experiencing this problem. Well, no, what we learned is it's just 2 buses after talking to the bus driver. And we also learned that it's just the 2 older buses that are the ones that are actually the problem. And so it's only a certain minority of the kids that are experiencing this particular problem. Now we're going to get more precise, all right? So rather than saying we need to change the bus heating system on all of the buses, we need to bring the windows, make sure the windows are up on all the buses. Nope, it's just 2 buses, all right? So we're getting more precise. We're drilling down to understand this problem better. All right, so it's just 2 buses, and these 2 buses are the older school buses that we learned, all right? Again, we're asking key informants. We're talking to bus drivers, we're talking to bus company, maybe the school in this case owns their own buses or whatever. So we are understanding this problem a little bit better. The 2 older buses, all right? We have to ask more questions, like where the bus is stored, what kind of fuel do the buses use? How often are they used? Are they used all the time? Are they cleaned regularly? And in this particular situation, we learned that the buses are actually stored outside. So they're stored outside the entire time. And as a result of being stored outside, and this is not a hypothetical problem. Some of you in rural Montana may have run into this. This is something that I have family in central Montana that ran into this problem as a member of school board, that the buses were stored outside, and as a result of that, then mice got inside these 2 older buses. And so the mice were having their, what are young mice called?
Micelets. Micelings.
Little mice, yeah, mice pups or something, I don't know. So anyway, they were having all the mice in the heating duct system. And so whenever the heat would come on, it would have this horrible smell, it would aggravate kids, and so it caused all these problems. So then we've drilled down, we've understood, okay, it's just 2 buses, it's the heating ducts, it's these mice, and as a result of this, now we can figure out what we're going to do moving forward. Okay, so we've drilled down, we've identified this problem, and we've identified the problem by gathering data from a number of different sources, all right? So this, whether it's obesity, suicide prevention, diabetes, whatever it might be, this is the process that you might go through as a way to potentially, again, drill down and identify exactly what this problem is. Then once you've identified that problem, we can begin to say, all right, now based on that, let's go ahead and figure out what we're going to do moving forward, okay? So if you go ahead and move it to the next slide. All right, so these are the major sections that are ever included in a grant proposal, all right? So it may be that there are times that you have other sections that are included in a proposal, but for the most part, these are your primary sections, okay? And it may be that sometimes these are sections that are in a different order. It may be that there's only 3 or 4 of these items that are included in a grant proposal. But what we try to include here is, for the most part, these are all of the different sections of a proposal. So you'd have to address this in some way. So in this case, we've got the mouse problem, we've got the bus problem, and we want to figure out how to solve this thing, all right? There may be times that you don't need a grant proposal, all right? So maybe like, I don't know, let's just figure out how to go, and sometimes buses are owned by bus companies like they are in Missoula and larger cities. Let's just go to them and say, fix the gold arm buses, clean them out, get the mice out of there, get different buses, whatever it needs to be, let's fix that problem. I don't need to maybe go all the way to submitting a proposal and going through all that process. It may be easier just to do that. Okay, so that might be an option. All right, or maybe gosh, well, we've got, the buses are owned by the school and managed by the school. Is there just a donor in town that we know that has enough resources that they could address this problem? So could I go to a local individual that has contributed before to the school to solve a particular problem? Can I talk to them? All right. Now as I'm getting older here, sometimes I think I would just rather go right directly to a person who has money and say, I need $20,000 to fix this problem, and here's what I need to have happen. It's fairly quick, it's efficient, and sometimes doesn't get into the whole grant writing process. So that is one way to potentially address this issue, is go directly to somebody. And then the other might be, all right, we're going to need to figure out how we're going to be able to get, maybe it's $20,000, $30,000 to fix this problem. Maybe we have to buy 2 new buses. We got to figure out where we're going to need to go in order to receive funding to do this. So for the state of Montana, it may be a foundation that serves the state of Montana, like the Washington Foundation. It could be Helmsley Foundation. They wouldn't deal with this. They deal with a lot of rural health issues, but we may be looking at, all right, now we're going to have to go to a particular source and figure out how we're going to address this problem. Now, when we do that, then we're looking at these different sections, all right? So we've got this problem. That's one of our sections. Now we've got these other sections that we need to take a look at as well. So there may be certain objectives that we're going to need to put forward. Now, these objectives are oftentimes then worded in such a way where the verbs that we are using have to do with reduce, decrease, or eliminate, all right? So we want to figure out how we're going to reduce obesity rates, how we're going to decrease suicides in Roosevelt County, all right? So we may get specific about what it is that we're trying to do, or we might try to improve self-esteem. We might try to improve confidence of. There's lots of different measures that we might take a look at in terms of what we want to accomplish. In this particular case, rather than decrease the number of kids that are freezing when they come to school, I think that I would like to eliminate any children that are showing up to school who are freezing or have asthma problems or whatever the situation might be. So I might use that as my verb, is I'm going to eliminate this problem. All right, so I don't want to reduce by 10% over the next year. I don't want to decrease by 20% the number of kids. That's oftentimes objectives that are using, but in this case, I want to eliminate by 100% any children that are showing up to school cold, wet, and have asthma-related problems.
I just want to jump in for 1 second here. And what I want to say about that is, one thing when you're setting your objectives, it is always good to be realistic. I see a lot of people write grants, and I have written them myself, where I say that I'm going to eliminate a problem or reduce it by 50% in the first year, or add 7 new sites in the first year. And that sounds great, but funders they want you to do something realistic that you can do really well and be sustainable too. So sometimes, even though you feel like you're asking, well, we're going to add 1 new site in the first year and reduce this by 5%, that sounds really small, but if it's what you can do and it's the important first step, stay as realistic as you can in those two.
I think it's a good point, Robin. I think it's ambitious but realistic. Mm-hmm. All right, so if you said, I want to decrease the number of children who are freezing when they come to school by 2%. Somebody's going, what is this?
Yeah, we don't care.
I'm not excited about that. That's ridiculous. So it's almost like, all right, I got to be realistic, because the people who are reading this got to think, well, that's way out of line. There's no way they're going to be able to accomplish that. So it has to kind of be on this balance between being realistic but also being ambitious. So it looks like we're a group of people who are going to get stuff done. We are going to take care of this problem. At the same time, we're realistic about what we can accomplish. That's a good point. All right. Now, another part of this has to do with what benefits are going to come from achieving these objectives. All right. So we're going to eliminate this. So we're going to have kids that can focus on school in the morning, that are not going to be freezing cold when they show up, that are going to not have health-related or asthma-related problems when they show up to school. There's going to be a number of benefits that are going to occur as a result of this. This is going to be something that won't just benefit young people. Maybe even the bus driver might be freezing too. They're not going to just benefit them today or over the next couple of weeks, but this is a solution that should be beneficial for the long term as well. And that's something that also folks are looking at, saying, all right, so we're going to solve this bus problem, and that's going to be great. But sometimes we have programs or interventions that may be really short term, where it might be like, well, that's going to be helpful for the next week or the next month, or it may be something that's sustainable or lasts or has an effect for 6 months or a year. In this particular situation, this may be something that has long-term effects. So we can speak both to short-term benefits and long-term benefits in this particular situation. We also might have benefits related to less than the likelihood of kids getting sick and missing school, less than the likelihood of kids needing to go to the doctor, all kinds of other kinds of benefits that may be a part of this. There are also many proposals that don't put the benefits in there, and they may have it either not in there at all, or they may have it someplace after solution, all right? Now, then we got to come up with a solution or idea. All right, now this is the part that oftentimes is worded as methods, all right? So it's really, I'm going to use a couple different words here. So one is your solution, your intervention, or your methods. They're all really kind of interchangeable. This is what we're going to do, all right? So this is our plan. This is what we want to do, okay? So you're going to see we move into another section here that it's going to be methods. It's going to be a methods section. What are your methods? What are your activities? What do you want to do? And this is where we want to lay out really specifically exactly what we're going to do to solve this particular problem. We've identified what the problem is. We said, here's what we're going to do. In this case, we're going to eliminate. Here's what the benefits will be, and here's how we're going to do it. All right. Now, in this particular situation, it's pretty straightforward that we're either going to change the ductwork, get rid of the mice, or get new buses, something along those lines. We're going to choose one of those. And it may also be dependent on the solution we choose, will be dependent on the funder's ability to put money into this particular solution. So it could be, I don't know how much a bus, I'm not much of a bus shopper, but my guess is they cost, I don't know, I mean, probably $50,000. Car costs $50,000, but probably $100,000 each. All right, so maybe there's not, we need 2 new buses. It's like, no, all right, where are we going to find $200,000? Okay, so we might not be able to find that. It might be that we say, all right, well, how much is it going to cost to change this ductwork out? All right, so we get an estimate from somebody who says, all right, it's going to cost you, $1,000 per bus. All right, that might be more doable. So you might have to think about what's also feasible in terms of the solution that we propose and the funding source that we're going to be looking into. What is it that they can afford to do to put this to address this problem? Now, I might also at this point have a conversation with my potential funder. Okay, I'm going to use the word funder and investor. All right, so I always look at this as an investment. So I've been on the funding end of grants as well. I'm thinking from a foundation source, what are we going to invest in? Because we want to invest in the health and future and vitality of Montana, and we want to make sure that we get a good return on our investment. So we're going to invest, could be $200,000 for, again, the 2 school buses. Is $200,000 a good investment? All right, well, it might be, because if instead of putting $1,000 into each bus and have it break down again, and it's not working, they're old buses, we need another couple $1,000s, we keep doing this over and over, we're not really solving the problem. So it may be a better investment as a funder to think, well, in order to really solve this problem, we'd rather just get 2 new buses in this situation and move forward. Now, another thing for you to think about, again, and it's dependent on the foundation you're working with, or it could be a foundation, or it could be state or local government, or it could be county commissioners, or it could be a federal source that they have a lot of money. All right, so oftentimes you may have foundations that think $200,000 is not that much. All right, so I like to make sure that you're thinking about what is it that you need to have in order to solve this problem. All right, oftentimes what we do in whether it's social services, public health, and my background is all in social services, we think, gosh, how can we get duct tape and paper clips and put this together and do this for $1.75? All right, here's how we can really make sure that we're incredibly frugal and resourceful in coming up with a solution. Okay, and that's the way I think. But when you're making a pitch to a potential funder, and they have $10 million, they're not thinking paper clips and duct tape. They're thinking, what do we need to do to solve this problem? And $200,000 might not even have them bat an eye. They might think $200,000 is a great investment. Again, we're going to get a good return on our investment based on the fact that we would be only, in this case, funding at $200,000. So it's worth thinking about, what do we really need to have in order to make sure this problem's solved? Most of the people that you're putting this proposal forward to are people that work, they may be attorneys, they may be bankers, physicians, nurses, it could be people in lots of different sectors who are used to solving problems by putting an adequate amount of money into solving that problem. And we are oftentimes conditioned to think, gosh, I don't know if we should ask, boy, I don't know. No, we need to solve this problem, and we're not going to be apologetic about asking for whatever it is we need in order to move forward. Now, the other part I'll mention about this particular section is related to when you get into obesity, substance use prevention, diabetes prevention programs, whatever it might be. There are many times where foundations and federal sources are saying we want to have a solution that's evidence-based. So if you can give me like a thumbs up or something like that, if you understand or know what evidence-based, evidence-informed, research-based, promising practice.
Actually, if you put it in the chat, that would be the most
Yeah, or
helpful.
put it in a chat and say, yes, those are words that all of us have heard of, we know, we understand. Good. So that it's not new to anyone. This is a place where we might be thinking, all right, we need to have something that's evidence-based. So it may be that applying, especially to a federal source, we're going to need something that's an evidence-based program or an evidence-informed program. So it may be something that has been scientifically proven to be effective for this particular problem that you've identified. With this bus example, you're not going to find anything that's evidence-based. It's just common sense that we need a new duct system, or we need a couple new Goldarm buses. But it may be that we're looking at an obesity prevention program, or we're looking at a suicide prevention program, substance use prevention program, whatever it might be. It may be that the funder's saying we want something that's evidence-based, all right? So we need to make sure that we have looked into the literature and understand, and there's plenty of, and we can also help you with this, figuring out if that's an obesity program, obesity reduction program, whatever it might be, we can help you find ones that are evidence-based. So that for your population, in your geographic area, for the population that you're trying to serve, again, we drilled down to identify that as our problem. This is what has been proven to be most effective, these 3 or 4 interventions, and we're choosing this one, all right? So your funder, again, thinking about this is a good return on investment, isn't a solution where you have said, hey, well, we were sitting around the other day and we decided to have a couple margaritas, and we decided it would be great to have everybody get trained for a marathon. And it's like, okay, obesity reduction marathon, is there evidence to prove that that in fact works? Or is that a solution that just a bunch of people came up with when they're drinking margaritas in this situation and isn't based in any sort of evidence, all right? That's a problem. So we want to make sure that the problem you've identified is objectively substantiated. We want to make sure the solution or the methods that you propose are also one that are based in some evidence or science that say, yes, in fact, this has a high likelihood of success.
And I want to just jump in here quick to say that especially when very rural places or very small programs are writing grants, that's a little trickier because there are a lot of evidence-based programs that are based on very large populations or very city urban kind of atmospheres or environments or services that are available or whatever. So one thing I would say is don't be afraid still to write that grant, because there's also best promises and promising practices. A lot of times what you can do is, or else you're actually like trying to get some grant funding for a program that's already underway. You're not going to just like take something new and put it into your situation. But there's a lot of ways to like kind of, you still do your literature review. Look, what kinds of pieces of this program do you also see in the best practices or the evidence-based practices? You can often still make a really good case for what you do. And sometimes what they let you know is there's a few things in our program we need to change to really be, more, I think we can be more effective. The research shows we could be more effective if we did some things different. So there's more ways than that to work it. It's not always as simple as just you find your evidence-based program, you put it into place and you're good. And that's fine. You can still write that grant.
The other part of it too is we're going to propose a solution that's been proven to be effective in Greeley, Colorado, or someplace in New Hampshire, or wherever it might be, so that you can say, this is the problem they had, this is the solution they proposed, and this is the outcome they had. And we are stealing that idea from Duluth, Minnesota. It doesn't matter where the heck it is. If it lines up well with your population, your geography, everything that you've identified with your problem, steal it from some other place. I often do that and try to take solutions and bring them to Montana, is I'm going to California or Minnesota or other places in the country, New Jersey, and saying, gosh, this is a great idea. This is something that would work well for Montana. We haven't even thought of this. Somebody else came with a solution, perfect. It's also better for the reviewer to say, this isn't something we're gambling on in terms of something that's just come up as an idea that may have a low possibility for success, something that's been proven to be effective in other parts of the country, and we're importing it into Montana. All right, we'll go through these others here as well. I'm going to ask you what questions you might have before we move into another section, take a break here. All right, the next section has to do with evaluation. So they're going to ask you, how are you going to evaluate whether or not, in fact, you achieved those objectives and you solved that problem? All right, objectives and evaluation are going to fit together. So if we say we're going to eliminate, reduce, decrease, increase, or improve, all of those different verbs that we might use in order to show that we've had an effect on this problem, we're going to need to evaluate whether or not, in fact, we did it. So we're going to need to tell the funder yes or no that we accomplished that particular goal in this evaluation section. Some of the smaller foundations that you might work with, or local foundations or regional foundations that aren't as large, may have a very low threshold for what that evaluation section looks like, or the process looks like. So they may say, as long as you're able to somehow document that in fact you solved that problem, we're fine with that. So give us a quarterly report or an annual report, or whether the performance period ends, and say, this is what occurred. So maybe with some of the programs that you think about in terms of suicide prevention, obesity prevention, or whatever other prevention programs you might be looking at, or intervention programs you might be looking at, could be a survey of those who participated in the particular program, and here's what we found out with the survey. It could be that you have some sort of data that you've been collecting before in terms of the number of people who are served, and then after the intervention, you're looking at that same data to see how many people are being served at that point. It may be that you are looking at county level data that could indicate, yes, there's been a change over time, and so that data is what we're going to look at. It could be that you talk again to your key informants. So you talk to your key informants in identifying the problem. You might meet with the key informants again to evaluate whether in fact they see any change as a result of the intervention. So in this case, it may be that we're going to go back and talk to people in schools, parents, teachers, and say, what's changed? Are kids cold? Are they coming to school wet? And is it a problem anymore or not? It could be very simple in terms of our evaluation with this particular problem in this section. Now, there are also going to be some funders out there that say, we want an outside evaluator to evaluate your program or your intervention. So we don't want you to evaluate your own success of your program because you have too much of a bias. Because we're giving you money, then you're likely to report back, hey, everything's great. We solved that problem. We have no more diabetes, obesity, whatever it might be, and we're ready to receive another check from you for another year. Well, we want to make sure that a lot of those funders want to make sure that there's an independent evaluation that happens separately from you, so that somebody who's more objective can come in and say yes or no to whether or not those objectives have been met. In those cases, and we do a lot of program evaluation, there may be people in your region that do program evaluation. If you're in a real rural area, sometimes this puts you at a little bit of a disadvantage trying to figure out who you could get to do the evaluation. And it oftentimes depends, again, on the RFP, request for proposals, or the RFA, request for applications, that state, here's what we envision in terms of our expectations for evaluation. And then last section we have here, I think we have another slide, but we go through, is how sustainable it is in this particular situation. Sustainability is around, we get the 2 buses, we're done. We're not having to ask for ongoing funding. A lot of folks want you to think about and to document whether or not you're gonna need ongoing funding for this or not. Is this a one-time funding need, or is this something that you're gonna be dependent on us for the long term? So are we gonna be able to, in this case, we're hoping, I think with the bus situation, we get new buses, we're done. We don't have no more relationship. And that can be very attractive to a funder versus this is a 5-year relationship or a 3-year relationship. So oftentimes it's very difficult when you're looking at problems related to, especially in prevention or treatment related to common areas that you're working in, to think that is going to go away in a year or 6 months. It's oftentimes changing a system and a culture and a way of thinking, new behaviors, new information, new knowledge that takes years and years. So it may be that you are needing funding that goes well beyond 1 year. And again, this is another place, like Rob was mentioning, to be reasonable. This is not going to be solved in 1 year. Diabetes prevention is going to take us multiple years, because we have many different factors that we're going to have to address in order to comprehensively solve this problem, that are going to take more than 1 year to complete.
You know, one thing I'll say about sustainability too, especially in terms of public health grants, I worked in public health for about 10 years and did many different things, wrote some grants and did some accreditation. But I feel like more and more over that time, what I saw is grants that you were required to collaborate. There's definitely some grants for public health that are very specific to certain kinds of programs or certain kinds of activities. And they have a lot, those have really clear boundaries, but a lot of the stuff like diabetes prevention or obesity prevention, you know, the bigger and more intractable problems, part of what funders are asking for in sustainability now is to group up with other people, to do it as a collaboration, so that it's multiple budgets, multiple people coming together to make it happen. And that also makes it part of the culture of your community solving that problem too, so.
And this a good point as well is related to then saying we need you to apply as a collaborative, or as a cooperative, or as a partnership. Those can also be tricky situations where, again, you might have been competing as counties, and maybe, you know, the high schools compete in basketball and football, and they don't really work well together. And it happens a lot in rural Montana. And so how are we going to develop a partnership that is really a true partnership or true collaborative? And that may be difficult to develop those kind of relationships with groups that you traditionally haven't worked well with, trying to figure out how to do that. But it's essential in terms of your ongoing success to figure out how we can do that.
And beyond that too, it's like sometimes grants, like they really want to make sure that they're having a large impact, and just in a small county, you can't show the numbers. But if you do a region, you can really show the numbers and a change in the culture of how that area works.
And one of the ways that I've done that as well is saying, all right, $100,000 is the maximum amount that we can apply for. How can we split this up in order to make sure that everybody has an equitable amount of this budget? It may not be completely equal, because somebody may have to host it. And I'll usually say, why don't you guys host it? Why don't you guys go ahead and take the lead on this? So you might get a little bit more money than we would get. Okay, I'm concerned about kids and families. The money part of it isn't as much of a concern for me. I want to make sure that people are saying, yeah, that seems fair. That seems equitable, and we're going to be a part of that, versus it has to be 1/3, 1/3, 1/3, or we're going to get more because we came up with the idea and brought you all together. I'm going to show you that I'm about the solution rather than who's going to get the money, because I really do want this to be a collaboration that succeeds today and then well into the future. All right, do we have another slide?
Let's see. It's not letting me slide it. Let's see what's happening here. There we go. Let's see, are we on?
Is that it? That's not it. I think there's a budget. We'll go back to the other one, I guess.
Yeah, I didn't get
I think the last part that would have to be on here that we'll get a chance to review as well is related to a budget and then figuring out how to go about putting that budget together and how much it would cost. And so we'll have time to talk more about that as we move forward, of what that budget would look like, and what sort of elements may be included related to are we going to need salary? Are we going to need fringe benefits? Are we going to be medical insurance for a full-time employee? Supplies that would be needed, travel that would be necessary. We'll talk a little bit about budgets as we move forward. With this particular situation with the buses, it may be, all right, we're just going to need new buses. It's going to cost this much, or we're going to need to have somebody fix it that's going to cost us this much. So budgets are another part of this too that we'll spend some time talking about. So why don't we do this before we transition here, Robin, is just say, if there are any questions that anybody has. So I'm going to mute this and you go ahead and turn your volume up and see if that works on our end. And we're going to get this fixed at our break to see if anybody has any questions at this point. What you're trying to do is sort of tell a story. All right. So we're putting together this grant proposal is about being a good storyteller. How is it that you're going to tell this story? And one of the most important things in telling the story is making sure that you know and understand who your audience is. And it may be that you don't know who the reviewers are. You might have some idea, but you could be able to dig a little bit in order to learn a little bit more about who your audience is. So you want to make sure that you are writing to that audience. Robin, I'll let you.
Yeah, so let me take over from that. And so part of this is stuff that's all on that grant writing tip sheet too. And it's just to kind of list it out so it's easy to remember. And part of knowing your audience and reviewers is actually just like really, really doing your research to make sure that you fit that grant. Because it's not uncommon to get really excited about a grant and think it would be so great because what you're seeing is money for a program that you really, really care about and you're so excited about it. And I've done this and I've had people bring me grants like this too that say, it's like, look, 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 here's this grant, let's write it. And you look and you're like, I think that there's a few key pieces where you don't match. So just read the RFP really, really closely. Read it closely, go to the webinar that they offer if they do on the grant, read their FAQs, go to the website, learn more about the funder. And this doesn't have to take super long. It just means you're doing your due diligence to make sure that you are really a good fit for this grant. Because you don't want to waste your time because it takes a lot of time. Sometimes you look at it and you're like, I think we're on the edge, but I'm going to try for it anyway because it would be so amazing if it worked and I really believe in this. Sometimes you just can't do it. One thing I find too is there's some great looking grants that they're only going to offer 2 or 3 nationwide, and those you just need to think really, really hard about before you do it. Unless you are absolutely so ready to write that grant, I wouldn't do it. It's just, especially when they're federal grant, ones that give out that few are often earmarked for certain, they have people in mind already. So definitely do your research and feel free to reach out to the people who are offering the grant. In the cases of a federal grant or something, they often are going to tell you, no, you have to go to our FAQs in our webinar or submit questions in a very formal way. But especially when you're working with a foundation or something, they often will be happy to answer your questions and help you make the right decision. So go ahead and do that.
And I would say also with regard to, you go back to this slide. Okay. With regard to meeting with reviewers and foundation folks is, knowing well what their expectations are, what their emphasis areas are, what they're interested in. It's almost like you're doing a pre-interview before you submit it. So you've got sort of insider knowledge on what they're looking for to know whether or not, again, like Robin mentions, whether or not you're going to line up well here.
Yeah, and there's resources to do that if you have any access to a university library, which I just happen to have, so I can help you. But you can also look up Foundation Directory online and look up their 990 forms, they're called, for the funders, because they tell you what they funded in the last few years and in what amounts. And that often gives you a really good idea of whether you're going the right direction or not. Because sometimes you'll find out, oh, wow, they've only really given to like summer camps in this certain area ever. It's like we might be the one time that they decide to branch out, but we're going to need to build that relationship with them first. That's not probably just going to happen by us submitting a grant. So
Okay,
I see the question of
990
990 forms. Those are forms. They're an IRS form that foundations have to file, I think, to keep their nonprofit status. And it's about, not all foundations have to do it, so they must be set up in slightly different ways that I don't understand. But most foundations have to file this 990 form with the IRS, and it's public. It's open to the public, and so there's different places that collect them so that you can look them up to kind of learn more about foundations. And one of those is Foundation Directory Online, and they have a free 990 search piece of it. They keep changing how they set it up. I think it's actually through a company called Candid now, and so you can look up Candid online. But yeah, so that gives you some information, and that's kind of nice too, because you can actually sometimes figure out ways to look like in certain zip codes, you know, who in your area or who in the state of Montana is giving out grants. So if you're interested in learning more about that, contact me. I'll help you. And then the next thing you really got to do as you're getting ready to write the grant, there's a lot of getting ready pieces that are going to make your writing so much easier, is you build your team. And your team might be, you're working with the people you're collaborating on, you know, the collaborating organizations. Your team is also internal. It's like who there is going to help you put together the appendices, especially if you're doing a federal grant or some of the state grants. You have a lot of stuff you have to prove. You have to prove that you're financially capable of handling the grant, that people have the right licenses. You know, there's all kinds of stuff. And the appendixes are usually really listed out. But who's going to help you find that stuff? Also think about who is going to help you proofread when you're done. Because there's times that I've been like 90% of the grant team. I've done 90% of the work, but you still got to find somebody for that 10% that's going to proofread your grant, that's going to give you technical information on how the computer data systems are going to work for, you know, collecting it, or that's going to help you. For me, it's always like figure out all the details of the budget, like how you figure out the fringe and how you know, have I gotten the right numbers here? So that's your team.
I'd also say something about the team. That this proposal writing team is also your intervention team to some degree as well. So if Robin's writing the whole thing herself, which I know some of you are in situations they say, hey, would you write this grant? And you end up being the person writing it, then sometimes it's sort of assumed that you're going to be the person that's going to do it too. And it's like, well, this requires a group effort. And the reviewers and the funders think that this is going to be a group effort, that there's going to be a team that's going to pull this together and make this happen rather than one person. That one person quits or something happens, and all of a sudden you lessen the likelihood that, you know, that's going to be successful going forward. And again, as an investor, I don't want to put money into something that is not going to be successful. So who's the group of people that are going to make sure that this is written, but also then carried out? You also have to think about your team with regard to who are people who are just straight out get her done on time people and meet deadlines. So if there are people that you think, oh, gosh, I don't know, they could block this, they don't like change, it's difficult for them to get along with so-and-so, it may be really thinking selectively about who would be a part of that team as well.
Yep. And also just like there was one time that I got desperately sick in the 4 days before a grant was due. And if you have nobody else that is helping you out with that, you are in trouble. So just having somebody who's aware of what's going on and can kind of step in and pick up the pieces is just a really good idea, especially if it's a bigger grant. And so then the next thing to do is kind of organize those tasks. Just be really clear about who's doing what kind of schedule you're looking at, get everybody on the same page. Make sure you've got your own checklists or calendar or Gantt chart or whatever it is you use to kind of organize your time so that you know what you're talking about. And sometimes a grant falls apart in this piece, honestly, because you just realize that you have nothing like near enough time to pull it together at this moment. But you've still done some good work to figure out who your team is, and you can use it going forward. And then finding your data, that's always a big piece. It's like, you know what you want to look for, you know what you have already, a good list of what you've got, what you need, what you would like to find. And especially in rural areas, it's tricky to find data. At the center, we use a tool called Policy Map that can sometimes help us more get rural data than most other sources I've seen. So you can contact us if you're just trying to see what you can find. But I would also say you can do a lot of combination of data. You could say, well, in the state of Montana, we know that this is true about obesity rates or whatever. We also know, or say we're doing something more like a hunger and nutrition thing. We know that this is true statewide. And then you can say locally, we know that our demand for the food bank is this, or that our free and reduced price lunch is this. And you can start to layer up different pieces and levels of information to create the story. You may not have that 2 or 3 big pieces of data that just shows, you know, boom, shows it right now, but you can definitely put together lots of data that really tells it well. So be a little bit creative about thinking what kind of data you have.
We also have on our webpage, and hopefully we have a chance to show you at some point here too, a data dashboard. So what we have is the entire state of Montana broken down into every single county, so that you can go into your own county and then you can look at, we have like 110 variables. So it could be the number of kids under the age of 5 who are receiving WIC, the number of veterans that are located in your county, or percentage of veterans that are in your county. So before you have to start digging around, and we'll show you where our webpage is and where this data dashboard is. It's called the Montana Data Dashboard. It's at our webpage, that you could go into every single one of your counties and be able to get the vast majority of data that you'd be looking for, so that you're not having to search all around for it.
Yeah, and also that's linked on the close to last page, the second to last page, I think, of this PowerPoint as well, which you have gotten in the mail. So there will be an easy way to get it through that too. And then when you get to actually writing the grant, the way you write it actually does matter a lot, because you can make it kind of a very bureaucratic slog where it's hard to really retain information, or you can write something that's very direct and to the point, and really help, you know, like it makes it very vivid. It can make your objective really vivid and your needs really vivid. The best way to do that is use active verbs in short sentences. Most people who write grants or different kinds of reports would say no more than 15, maybe 20 words a sentence. So, you know, if you've got a big long idea, try to break it up a little bit. That also helps you use active verbs, also helps you keep short sentences. There's, oh, I have an example. I'm going to pull out my example here. There's something I call, there's no real word for it, but I call it verb strings that tends to happen in bureaucraties that makes sentences very long and hard to make your way through. But they're really easy to avoid usually, because they're things like, I just looked these up actually, and the federal government writes this way, so just don't, sometimes your RFP is going to be written in a way that you absolutely do not want to write your grant. But there's lots of things that's like funds to support the development of, how about just funds to develop? Intentions to aid in the implementation of a, how about just our intention is to implement. Organizations are planning to research. Our organization will research. Or the proposal must also demonstrate a plan to target. That was my favorite one that I found. You can just say the proposal must target. You know, there's just a lot, and it's so common to write that way, and you shouldn't feel bad if you do, because we read it all the time. But just really think about making those active verbs and like figure out where you can shorten it down, because you just have suddenly made it so that somebody is going to understand it like that, kind of lightning quick, and it's going to stick in their mind. And then the people who are great writers can get to be really formal when they approach a grant in a way that they don't need to do. You don't have to be all chummy and funny and exclamation points, but you can show enthusiasm. You should be excited enough about this this project that you show your enthusiasm, that you think it has a lot of potential, that it's going to fit your community well, that's going to be great, that it's going to bring different groups together, that it's going to change the culture of how you approach a certain issue. Go for it. But just in the middle of that enthusiasm, make sure to be specific. Make sure you're not saying, this is going to be awesome, everyone will love it. You know, you just need to say, it's like, so-and-so has been trying to get a program started like this for many years. You know, in partnership with this, we think this could make a huge difference in our community, and our community has expressed the desire for this kind of program, or something like that. So you're still being enthusiastic and showing that you really want it, but you're not making a lot of just, this is great. And there's a lot, and it's really tempting to just say, this is going to be an amazing program for our community, but that doesn't tell the grantors anything and waste your space, because sometimes you have very few pages to be able to tell this stuff in. And of course, minimal bureaucracy. So if it's really jargony and you really only use it inside your own line of work, or if they're acronyms that are just not going to be super, super clear. I mean, you can use acronyms and tell them what they are the very first time, but don't do that so that you have sentences that have 5 different acronyms in them. You know, choose the most important acronyms to use and the other things write out, because it's just impossible to make your way through. And you do not want to make this hard for people to read. And then it just really, and that's the benefit of having other readers too, is that they will call you on your jargon and just find other ways to say all of that, because it's just going to make it so much easier to understand, so much easier to remember. You don't totally know who's reviewing your grant, and you want to make sure it's really accessible to everyone. And in every piece you can possibly do this with, build your case with data. Use that as your storyteller. Your story should be told using data in pretty much all aspects of it. So there were some days, you know, it's been a long time now, but I've seen some grants that are kind of like, geez, we really need a parenting education program, and that would be so good for us, that managed to get funded. But I think those days are mostly gone. Just because it sounds like a really good idea is not going to get you funded.
I'd also add, make sure that you're following instructions. So they're going to be a number of different funders have different instructions. Some may be very loose and say, well, we're looking for, just tell us your story and we'd love to hear from you, and let us know what you need and how you need it. And oftentimes those are new foundations that haven't really established themselves yet, and those can be good ones to approach because they aren't very well organized and they don't have a lot of real rigid standards in terms of their expectations. But you're also going to have a lot of funders who say there's a 15-page limit with 1-inch margins that you will use Helvetica 12-point font, all right? If you decide, I don't like Helvetica, I think Arial looks prettier, they will throw it in the garbage. And I've seen them do it. So follow the instructions. I remember once a group of people who received, I think they had like $450,000. It was through, I think it was like a domestic violence related program. They had federal money and they were going to get another $100,000. All the different people who had applied for that money and received the first $500,000 were going to get the next $100,000. They said there was a 10-page limit on submitting the next money that they were eligible for. It was like everyone's going to get it. Okay, 10-page limit, 1-inch margins, times New Roman, 12-point font. Okay, they ended up having like 12 pages. Or God, there's no way we can condense this. We only can say it in 12 pages. So they changed the margins in order to make it fit 10 pages. And they changed instead of double space, it was like 1.5. And they threw it out. They said, you didn't follow the instructions on this, so you're not going to get the extra $100,000. And this is out of Hamilton. And they were mortified by the fact that they weren't going to get the extra. They said, if you can't follow our instructions, then I don't know that you're going to be able to use this money, spend this money wisely. So we're not going to fund you. So there are foundations, and certainly at the federal level, federal grants that are like, just follow their instructions exactly the way they have them stated, because there are some people that are incredibly anal, that are reviewers, that will go through all of that first before they even start to read it to make sure that you follow the instructions.
Yeah, and there's a lot that are in the middle too that they won't be quite that prescriptive, but they will also, like for each section, they'll say this section must address, and they'll have a list of 7 things. And you better not miss one, because if you miss one, you're done. And that's when your proofreaders can help you out too.
Okay.
So we're at 9:15.
Exactly. What did you say?
1 minute till break. Yeah.
Yeah. So anybody have any questions that we could answer at this point before we take about a 15-minute break here? We're ready to go.
All right.
All right. So I think we're ready for this next section here. We're going to move into So we kind of broke this up into different units, and what we want to do in this particular time period is hear from all of you. And first, between Kate, Robin, and I, know who you are, where you're at, what you're doing a little bit more. Hear a little bit about where you're at in the process of perhaps putting a proposal together. So ideas that you might have, problems that your agency's encountering and are facing right now, and some preliminary ideas you might have in terms of where you're wanting to go and what you're wanting to do. Then what we're going to do is we're going to kind of work through the different sections. Take one example of a problem that you're working on or working with, and we're going to go ahead and then just kind of run through a process with everyone to talk about how those different sections might be written with one particular problem that we can focus on for those small groups. So I think that, Emily, through your magic, you're going to be able to now randomly assign us, or maybe you've got it set up in certain groups, put us into 3 different groups, and it'll take about a minute for that to happen. Then once we get in those groups, it will either be Kate, Robin, or I that will help facilitate that process. I think, Emily, you put a timer on those groups. If I remember right, that's what we put a timer on, then it comes back as a large group. If you want to put that timer for like, well, let's say if you try to do like 40 minutes or 45 minutes, then we'd come back together as a larger group that we could talk a little bit about some of the questions or issues that might have come up. And then we'd be ready, I think, at that point to take another break. So
Certainly. Yeah, I'll set it for 45, but certainly you guys have the option to come back sooner. So if, you know, if you need to, and I will send your invites and make sure that there's one of you experts in each room.
And we'll all need to be able, me, Kate, and Ryan will all need to be able to share screens too. So
Everyone should be able to in their rooms.
great.
So let me make sure we're set to 45. And I'll have them move you automatically, so you should just pop in there.
really fast. So I was going to ask Kate and Robin just to give us a little bit of what you focus on in your group, and then any challenges that came up that we might want to address as a larger group here, just to make sure that we're addressing some of the common challenges that were identified in those discussions. So Kate, do you want to go ahead and go first and tell us what your group focused on and some of the challenges that we might speak to here?
Yeah, so our group represented, we had someone focusing on suicide prevention, another on chronic disease, and then we have 2 participants from Tennessee that are doing some rape prevention work as well. And so we used the time to kind of give an example about suicide prevention, which was our given example, but also to drill it down to say, okay, what does it look like to articulate, for example, the problem statement in your area? You know, one of our members talked about the process of learning from not getting grants. So we've applied for a grant over several years in a row. We were several points below receiving this big grant. And so each time we kind of tweak it a little bit. And so now we're in a place where we're ready to actually secure the funding. So I think an interesting conversation would be, how do we learn from those times when we don't secure the funding to improve our proposals in the future? So we talked a little bit about that, and we also talked about kind of the performance versus population level outcomes, and how do we articulate it so that we're clear about our objectives and the outcomes that we are shooting for without assuming population level responsibility. So taking on preventing suicide for everyone, everywhere, for example.
Gotcha. Okay, yeah. Excellent. I'm writing down these challenges, and then we get done. Let's go ahead and think about how we can have a discussion about ones that seem to be common issues. I'm sure this outcomes population level data is one. Good. All right, Robin.
All right, our group, we had a couple people who work in tobacco. One from Colorado that works in a Hispanic, that was Amanda, that works in a Hispanic small Hispanic rural community. And then also Granite County, Jackie, right? Am I getting the right name, or is that Jennifer? And then we've got people who work with kind of healthcare systems and emergency planning and needing services. So the grant we kind of talked about was needing some firefighting suits for volunteer firefighting organization and how you would make the case for that. And it was a great one to kind of look through because we talked about the difficulty in locating grant sources. That was a common one, especially ones to try more innovative programs that might not have an evidence-based, and that was just a bigger conversation in general. And then talking directly about suits, the need for suits for volunteer firemen, that was a great conversation because we realized how much more broadly you can paint the picture. And when you do that, how much better you can show the need, because we started just like, well, it's safer, it's OSHA safe, but then started to talk about the number of calls you go on, that you put on how much stuff firefighters really do and how often they have to use those suits, and how you need to have this be some kind of thing that you can always, every time you get a new volunteer firefighter, you can make sure you have a suit that fits and is safe, and how much support's provided to wildland firefighters. You know, and just the community needs to know how much stuff they really do, you know, just kind of an on and on, that there's a bigger picture piece you can paint. And it really spoke to the idea of Ryan, where you said, don't sell yourself short. There's actually, you might've started this because you've got a problem, you need 2 suits, but it's actually a bigger need than this if you want it to be sustainable. But the finding grants, and then also just trying to figure out how to really get grants to develop community partnerships and to really be able to get in there to the community, because a lot of times grants are very restrictive on what they allow you to spend money on. And so if you're especially trying to start working with youth or be more present in the community to gain trust, that it's really hard to figure out how to fund that.
Okay. Got it. Our group was, we had folks in a couple different areas. One that was common to 2 in Flathead and Butte was related to reproductive health, and spent a little bit of time discussing some of the challenges with regard to getting funding in smaller areas like a Silver Bow versus a Flathead County. Spent some time discussing some of the problems associated with choosing interventions now that are ones that may not be as accustomed to, that were initially set up as face-to-face. So you would have workshops that were planned or interventions that were planned where people got together in a common place and they did a training. We talked a little bit about the challenges associated with kind of a one and done training, and then also face-to-face, how all of that's going to need to be rethought. And we're going to have to get a lot more creative in how that's going to look, because we're going to have to do trainings like this from here to the who knows distant future, in order to make sure that you know, we're still addressing the needs of folks in communities, in this case adolescents, but having to do that training a little bit differently than we've done it before. Then also Jancy had brought this up with respect to how to bring multiple parties together in order to think about how you put a proposal out related to, this isn't something that just comes from one individual, but it's something that comes from 5 different agencies are working in partnership with one another in order to apply for. So as we were talking about reproductive health, and most specifically to adolescents, you've got all these different partners that are playing a role in these kids' lives. So it may be schools, it may be public health, it may be parents, it may be juvenile justice. So how do you develop like a 4-prong or 5-prong agency proposal in order to ensure that it's represented as such? And we talk about that as being a real strength, not coming from one entity, but coming from a 5-part group that has come together and understand what their specific roles are, in agency A delivering 25% of the intervention, agency B doing 25%, and what have you, and working in concert with one another in order to ensure that the outcomes that they're moving toward are shared amongst them. And also knowing, everybody understands the plan, as we oftentimes see in these kind of situations where you've got juvenile justice doing one thing, schools doing another, public health doing another thing, and encountering one another. So they're not supporting one another. It's like if you were to raise, you had two parents that were raising a child, they never talked to each other. And one approached raising a child one way and one approached a different way, and they never came together to talk about bedtimes or snacks or what they should eat. Often we have that with multi-partners, is they're not working together because they're all assuming so-and-so is doing one part and so-and-so is doing another, but they're not communicating with one another very effectively moving forward. So that's some of what we discussed. Let's do this. Let's take a look at what Kate, you had mentioned with regard to improving future proposals. Part of what we talked about too was telling the story. And this may also be something for the group looking at firefighting, is being able to effectively tell that story and being able to effectively articulate the problem that you're wanting to address. And I emphasize to my group that, you know, a lot of the people that are reviewers or funders are from my generation. So they were talking about reproductive health and consent and sexually transmitted infections and the intimate partnership relationship. All right, now, these are words that I don't understand that well because I think I come from a different generation. But I may be the person who's the funder. I might be the person who's the reviewer. And so I'm telling, in this case, Jancy and Lauren, you're the experts on this, and you need to explain it to me in words that I understand so that and not in a condescending way, so that I understand the world as it is now, as it applies to reproductive health in this situation. So I need to understand sexting and I understand it a little bit, sexting and Instagram and Facebook and all these other interfaces that young people are using to explain the problem. So I've got maybe an old school way of thinking about that particular issue, but if you've got a group of reviewers that are, and last foundation I was on, they were bankers, accountants, lawyers, teachers, other state officials that were on the review committee that were my age that wouldn't understand the problem. So really trying to figure out how you can articulate that so that we understand the nature of this problem, not just as it might apply to sexually transmitted diseases in this, or infections in this particular case, but also not having healthy relationships and all of the other problems that might cause as a result of not having healthy, intimate partner relationships. So if I have that problem explained to me better, then I can maybe understand, oh gosh, that makes its way over into mental health and into suicide and into depression and into well-being, all kinds of different places that that carries over into. So it may be a matter of thinking about your audience and making sure that you're articulating to them well, as you're the expert and you understand this well, what this problem is. And I think sometimes what ends up happening is that we assume, and I've been in this work for some 30 years, I assume that he knows, assume that I don't know, assume that I have no understanding of what's going on in this world as you're seeing these young people day in and day out. And I needed to explain to me so that I can see that, yes, in fact, this is really a problem, and a problem I didn't understand. And as a result of this, we ought to make this a priority. I'm not going to make it a priority unless you can really somehow clarify and be clear about this as being a problem. Kate or Robin, is there anything you'd want to add to that?
No, oh, looks like Robin. Oh, there you go.
Go ahead, Kate. Oh, I was going to say that another question has come up in the chat, which is where you find evidence-based practices. And so we've got a few things going in there about different resources where you can look for stuff. And we've got like the California Clearinghouse and the Healthy People 2020 and the University of Wisconsin Public Health Institute has a What Works for Health. They all have a little bit different focuses. Oh, and then the community guide. That's right. Of course, there's the community guide. So anyway, sorry. Yeah,
and as Faith put up there, SAMHSA has a a bank as well that is very helpful in looking at evidence-based practices and interventions. Let's talk a little bit about population level data and outcomes. Kate, can you explain that a little bit more so people understand what you're alluding to there? And this comes in the evaluation section. This is a common problem.
Yeah, let's see, good. Yeah, so I think it's, having worked in the prevention field, and I was sharing with my group and working with interpersonal violence prevention, I think it's easy for us when we're working at organization to want to take on the task of solving these population level problems like, suicide or substance use. And really, when we're thinking about and planning for our grant or the program that we want to get funded, is really teasing out the difference between kind of population accountability and performance accountability. So when we think about population accountability, that really does require sort of those broad level partnerships that where we're taking collective responsibility to change the needle, move the needle. So conditions of well-being for our children, for example. Whereas a lot of you all are in agencies where you're wanting to get funded programs that are impacting your client populations. And so you want to really think through, how is our program going to impact the clients that we serve? And then we want to think through, how well did we run the program? And so while it is fancy to say and noteworthy to say that our universal prevention program, for example, for kids K through 5, is reducing suicide, we can't really say that after 1, 2, 3 years of our program. But what we can say is that we have, through our program, the evidence that we're collecting, we've made a difference in terms of increasing protective factors and decreasing risk factors. And so just really being clear when we're articulating what we want the outcomes to be and what the indicators are that we're choosing, that we're not taking on too much of the burden of moving the needle of these population level results, when really what we're doing is impacting a program and the clients that our program serves. Does that make sense?
This is a big problem that's universal, and we see it with a lot of funders saying, we can use again suicide prevention, is saying, yes, I want the numbers to drop by 10%. And you may even state it in your objectives of saying, we want to decrease the rate of suicide in this case, maybe it's central Montana or defined area within Montana by 10%. Well, it's going to be really difficult to be able to measure that because first it's hard to understand where you're at now. And it's going to be hard to say, after 1 year, you've completely changed a set of behaviors and coping strategies to go from where you might have been in 2020 to where you are in 2021. But your funders want to see, we want to drop that. We want to decrease that particular rate. It may be that you're looking at a 5-year process to begin to hit those population level indicators, so that we do have maybe a 10% drop. We could look at trend over time to see that in 2025, whether or not we're getting that 10%. But like as Kate mentioned, if we have law enforcement working with schools and working with juvenile justice, and they're having a different set of conversations with each other, and they're cooperating more on how they do prevention with ER docs and with whoever else it might be, that is one outcome, all right? That is an impact of your program. So maybe think about that as something that you would state, this is what we're going to try to do in year 1, and maybe into year 2, is we're going to get a group of people to start changing the culture or the system and the way that we're doing our work. And so that if we can get those folks to collaborate more effectively, then we will begin to better affect those population level indicators on down the roads. We are doing what's called a social network analysis as a part of evaluation, where we're just looking at the the systemic culture in the way in which we're trying to address problems, rather than jumping right to population level data, because it'll be very difficult for you to prove to your funders that you've done that over a 1 year, 2 year period, because they're very large problems that take a long time to begin to impact. And that may be something too, I don't know if it was the Tennessee group you were talking about, Kate, that was mentioning that in their proposal, and as they go back and resubmit, and I like the persistence. I'm not sure who the Tennessee group is, but as a person who's been on the funding end, when I see people continue to knock on the door rather than give up, I'm like, I love these guys. I'm excited about them, because persistence is important in making sure that they do achieve these outcomes. They keep showing up again and again and again, and we ought to pay attention to that and make sure that we see that in terms of their ability to be able to follow through with the program as we move forward.
Yeah, and I'll just add, so it wasn't the Tennessee group, that they are butt kickers, I can tell. But when we had a conversation about learning from our proposals that don't get funded, I think the key thing is don't forget to reach out to that funding agency to learn from your mistakes. I just recently did this and it was interesting. It seemed like it was a little like hard for the funder to have the conversation with me, like, oh, this is kind of awkward to tell you why your proposal didn't get funded. But from my perspective, it's like, I want to learn and grow, and I want to get this program funded. So tell me what it is you're funding and what we could have done differently to make this stronger. And so I just encourage you all to, when you don't get funded, because you will have unsuccessful grant applications, that's part of the process, make sure that you're seeking input and learning from that process so that you can create a better, stronger, more fundable proposal.
Yeah, and even sometimes when they don't give you much feedback, you can still find out often who got those grants and take a look at those programs and see what was different about their program than about your program. And sometimes that gives you some clues too. So it's interesting to see what's out there anyway.
One more part I would reiterate associated with what you guys are saying too is, although the process seems fairly sterile in terms of, how you develop the proposal, the sections you write, all the rules and instructions on how to put it together, is also, there are people on the other end of that, and the more you have a relationship with them, the more likely you're to get in their head in terms of what they're thinking and what they're wanting, and that they would be looking out for your proposal to some degree too. So there is a certain amount of subjectivity that does leak into it that's based on me having a relationship or partnership with those even before I start writing that proposal, so that they know who I am, I know who they are, and we're starting to develop this relationship. By staying out of that process, you're putting yourself in a lane where you're just competing with everybody else without having any relationship. So a lot of this is about your networking skills as well, in trying to learn who these people are, what they're all about, what their priorities are, and how you might make that work. Same is true with regard to the firefighting fit. It may be difficult and challenging to find good fits, but you're going to save a lot of time and energy by having conversation with people that are program administrators before you submit a proposal. If you spend 40, 50 hours putting a proposal in to a group that would never consider funding it, I would sure rather spend an hour up front having that conversation to figure out whether or not this is even worth writing. And then if it's not, great, that's okay. Maybe there'll be something we'll do in the future. I'm gonna keep shopping around a little bit though, until I do find a better fit, so that I'm not wasting my time and a whole staff time where they get disgruntled about the fact that they haven't been funded because we haven't done our homework ahead of time to know whether or not it might be a good match. I guess we're already ready for another break. Another 15 minutes. So let's go ahead and do that. And let's get back here right about a couple minutes after 11 o'clock, and we'll be good to go and finish up this last hour. So I think we're ready to get started here with our last hour and last section here. What we're going to do is go through a couple of slides here, talk about some common errors that we see oftentimes when people are writing grants, that give you kind of an idea of ways that you might think about putting your writing together and thoughts together and ideas, presenting those that may be helpful. We also have sent out, I think Emily is the one that got these out to everybody, was the an example of a proposal that you can take a look at. We have also many other examples, some of our webpage. I think that Rob will show you here after a while that you can also access, take a look at them. I think the one that we sent you is kind of a middle of the road, kind of a proposal for maybe something that may be a simpler funder that's not so complex. There are ones that we purposely haven't shown you that are like federal grants that are 100 pages long. You think, oh my gosh, I'm never going to apply for one if I have to do something like that. So ones that are more doable. So we're going to go through these slides. We're going to go through a scoring rubric that's often used as ways to objectively score proposals that you'll see too. And want to have a copy of it so you have an understanding of what reviewers are looking at. And then we're going to talk a little bit about budget. So you've got a chance to think a little bit about budget, putting your budget together and match requirements that are oftentimes required in certain proposals. So we can speak to that a little bit. Any questions you have about budgets and how to put those together, as many people might not have a bookkeeper or accountant or something like that and have to do all of it themselves. And then I think we'll be able to wrap it up. The other thing to think about too is oftentimes there are funders that are looking for reviewers or review panels. And so it's a great way to learn more about putting proposals together by reading a lot of them so that you can see what's a good one and what's not so good, and how people are following the instructions. A lot of times what you have are people that might bleed sections together. So they might talk about evaluation or describe evaluation processes in the problem section, or they might be stating their objectives in some other area and trying to keep it really clean so that each of the sections you're addressing exactly what they want in each section rather than having them kind of bleed together, which makes it difficult. So sometimes the more you read them, the better you can get at writing them. So there may be opportunities to be a volunteer reviewer. And if that ever comes up, it will improve your ability to be able to write them by reviewing. So think about that as well. So Robin, do you want to join in with me a little bit here on this grant writing errors here and speak a little bit to some of what we have listed here in this particular section?
Sure, I will do that. In some of the big grant writing errors that you see that's really common is when we say things like we hope to and we plan to, and this is kind of get back to what we talked about in the writing period earlier. Just be specific. You can be enthusiastic and you can be whatever, but you've got to be specific whatever you do. So you just don't want to say it's like we plan to like improve the lives of clients at whatever. It's like we plan that this is how we're going to use our money. That $1,000 will be used to decrease child neglect among high-risk parents participating in Roosevelt County's Head Start program. That's super specific instead of just saying we plan to create better situations for kids in high-risk families. Be really specific with exactly what it is that you're going to do.
All right, and let me mention, this is like my super anal side is going to come out here on these parts here. So the other part of this too is that, again, you've got to think of people who have, in this case, $100,000, okay? And I'm notoriously cheap. I don't want to give $100,000 to somebody who hopes to do something, all right? So if you were building a house and you had to come up with you'd never be able to build a house for $100,000, but if, let's say $300,000, and your builder said, well, we hope to build this house, it would be like, are you kidding me? So I'm going to give you $300,000 for something you hope to do? All right, you've got to think the same way. So you're giving this, you're asking for money from an investor, and if you hope to accomplish something, I'm going to think, nope, I'm out. If you're going to tell me what you are going to do, So just like your builder, I am going to build a foundation by this date. I will have the foundation done by August 15th. And then on August 15th, we will do this, all right? Good, specific, and it's gonna get done. The we hope and we plan is like, that sounds like maybe it'll happen, maybe it won't. It's too wishy-washy.
Yeah.
The other part with the we is, I may not know who we is. So if it's a multi-agency proposal, who is the we? So is it that team? Is it the one agency? Sometimes when you're using pronouns too often, we won't know who you're referring to. So this is one that, as a reviewer, drives me crazy.
Yeah, and then the second part there, that we feel that many people feel that, is the same way. You need to be more specific about who's the we or who the many people are, and you don't want to just feel. You want to be confident, or you want to know. I mean, sometimes what you want to say is, we know that the community needs this, here's why. Or we know that the community is behind this, and here's why. You know, these 7 organizations have said they will be on our steering committee, or they'll be our sounding board, or whatever. And it's interesting because, like, I write using yous and we's a lot. I try to be really careful that when I do that, it's extremely clear who the we is. The other thing that people tend to do that's not specific enough is they'll say, this means that, like, what's the this? Or we, or every time you use this in a grant, you need to tell them what the this is, because it's a way to sometimes just write, this will help us. You've been talking about, like, all kinds of different program pieces, and then you say, this will help us do whatever. Well, what will? Which piece of it? You know, what actions? What are you talking about now? You can't kind of just use it as a junk term to move your sentence along. You have to be pretty specific about it. That will also help you shorten your grant proposal too, because you get a lot of the mush out when you start doing that. So if you do use any of the yous or we's, because they definitely help you write active voice more easily, you have to make sure that you are that it's super 1000% clear to everybody who that you and we are. And sometimes that means that you take a couple sentences and define a team or something in the first part of the grant, and then it becomes more clear. You can just say the team is confident that they can implement this or whatever.
The other part here says the 100,000, as you all know, should have another 0. Again, this is my
that was my typo.
Fault. I made an error.
That was me.
You know what? That was me.
No proofreaders. Okay, where are we going from here? Here we go. So meth is a huge problem in Cascade County. That doesn't tell me anything, and it's a mush sentence that you're going to have to define in your next sentence, so just get rid of it because you'll save some space. So that's where you can use something like this with the law enforcement division recorded for arrests, or you can say, you know, it's estimated that, you know, X% of the population has used meth, you know, whatever statistics you have to work with. You can, if you don't have great statistics to work with, that's when you can say, you know, 911 calls report, you know, an increase in calls about meth users, and, you know, you just find what you can use and use it there, but be specific with it instead of just saying it's a huge problem.
The other part of that too, Robin, is nobody knows what huge means. So huge, big, enormous, large, I don't know what that means.
Yeah.
So huge to me might mean something completely different to you. So we have to use data to get really clear and concise about the severity of this problem.
Yeah, it's definitely one of those don't tell me, show me kinds of situations when you're writing a grant. And they don't know you. They don't trust you yet. I mean, if they really knew you and trusted you, if you said, wow, this is a huge problem, they go, okay, I believe you, I've worked with you. But they don't know you. They don't know how you think or sometimes anything at all about your community. So specific is necessary. And then hundreds of people are negatively affected by radon. You need the numbers. I will say radon is a very tricky thing to get any exact numbers on anywhere ever for any reason, which is why it's so hard to get grants for. But whatever you're writing about, the more you can put in there, even if it's an estimate, even if it's some population level estimate that you had to figure out based on some study somewhere, makes a lot more sense. And I just stuck the community health assessment in there because I know that a lot of you local public health people in Montana have a good community health assessment to be working from. And it's great to pull both data and then any goals you came up from to there. If you are meeting a community goal in your grant that was identified through your community health assessment process, you should let people know that, because that's something that means the communities like come together to think about it, talk about it, and are kind of on board with it. So anyway.
The other part with hundreds or thousands, I don't know if that's, again, as a reader, I'm going to say, is that 100 or is that 999? That's a huge difference between those two. So there's not enough, it's not precise enough. You have to be really specific.
Yeah, for sure. I think this is just what we have about these common, like, kind of problems, the do's and don'ts, Ryan. So I think next we're on to your scoring rubric, which I will stop sharing this. I guess I should ask first, any questions on this kind of stuff?
These guys are so easy. They don't ask any questions.
I know, so nice. All right, let me figure out how to like share my
We can
correct.
say whatever we want to, and they never challenge us.
That's about, I guess that's a 4-hour Zoom thing, right? Okay.
Yeah.
Where did you go? Document? I have so many documents up here.
So one of the things that we also wanted to, or documents we wanted to share with you, is one that you can take a look at whenever you're submitting a proposal. You will have then your reviewers looking at a rubric of sorts, a scoring sheet, something to that effect, where they're trying to make it as objective as possible. So if I happen to be a program officer who you talked to, and you told me about your program, you told me what it was all about, they're trying to eliminate any bias I might have toward you. If I happen to also be a reviewer, sometimes I'll get a completely independent outside group to be reviewers like we talked about. Sometimes I'll have a certain number of people that are internal as part of that process. But these are the numeric options that they're looking at in terms of each of the sections that they're going to score. So you can see it's numbered 1 through 3, and it's, again, every one of the sections that we talked about earlier. I've seen them on scales of 1 to 5, 1 to 10, 1 to 3, so that in this case, and I'm going to talk about the first 3 sections. These first 3 sections are ones that I usually write last. So I'll usually get into the problem statement and say, all right, let's just deal with this problem. Let's take a look at the objectives, benefits, whatever. And then as we move forward, I may say, all right, let's go ahead and, all right, so yeah, you're looking at number 3 as being the high. So in this particular case, you're looking at the high score being the proposals that move forward. So in each of these categories, we would say 3 is the best score you can have, 2 is a middle score, and 1 is the lower score. So I'm not able to, and the project concept in this particular situation, project concept is overall. Well, now that you've read the whole proposal, does it fit with our guidelines and priorities? So this isn't a section as much as is it a fit with what we're trying to fund as a foundation or as a government level funder? Does it fit after you've read the whole proposal? Again, as a reviewer. All right, the abstract is just going to be a short section. It's going to be probably say, here's how many words you can include in your abstract. It can only be 100 words. And then I write that last. Not until I have everything else done do I put that summary of what this proposal is about. Even though it's at the beginning, I'm waiting till the end to write it. And then each of these sections are pretty straightforward with respect to what we've talked about before. And I think everybody has this as a resource so that you can take a look at this as you think about how this is being scored by anybody who's reviewing your proposals, so that you've got an opportunity to think about. And also we put this in the RFP outline we gave you, what kind of elements would be included in each of those sections. And then now here, how would they be scored so that you'd have a real clear idea of how they're coming up with that numeric total moving forward. And this also gives you some idea of, you know, gosh, we got to make sure that we address everything in those sections, but also that our writing is very good. And again, as you begin to move from from local foundation to more statewide and regional foundations, it gets a little bit more competitive. And that's for sure when you need to bring in those proofreaders. And I got proofreaders from outside my own discipline so that they can say, too jargony, I don't understand it. You've got to be able to explain it to somebody who's not in that field and use layperson's terminology. So if you're using words like, our goal is to empower or to increase self-esteem, a lot of people just don't know what that means. So you have to sometimes break that down in order to ensure that your audience understands it well. Another is to promote social justice. Well, I'm not exactly sure what that means. What activities are you going to be doing? We will be providing 50 meals each week to homeless families. Okay, now I've got it. That is clear, and I understand what that means. And I can understand what that means by being a person who's not in that discipline. Promoting social justice, I'm not exactly sure what that includes. That it can include all kinds of different activities, and you don't want to leave it to your reviewer to be thinking about what those activities are. Explain it, tell us what those activities are. Show us.
And I actually want to point, it's related to just kind of thinking about how you put together the grant. There's a bunch of grants too that will kind of let you know how heavily each section is scored. Like they might say, in addition to like having this rubric, they might be like, well, great, but the abstract section is scored at 30% of the grant. The score is going to be from that section, and 10% is going to be from the introduction, and 30% is going to be from the budget or whatever. So some of them, and that's, you still got to write all of these sections as well as you absolutely can, but it does give you a good insight into what these grantors are wanting you to really focus on. And if you are limited in time, you better pick the one that's worth 45% of the grant to focus your time on.
True.
So, and then Ryan, we had a question in from Jessica that was wondering about if it was ever okay to use data from foreign resources or from foreign programs, especially if we wanted to do something that was like more similar to say something that's happening in Canada or New Zealand or something like that.
Yeah, Jessica, could you give us an example of what you're thinking of by unmuting yourself and telling us a little bit more about this question?
Well, I wonder if Jessica has.
Jessica might be she was in my group, and she might have had a.
Yeah.
Yeah. So that's right. Okay. So I think I understand the question, and here's how I'm going to answer it with regard, especially with respect. I don't know it as much with regard to
she says that she doesn't have a microphone.
Yeah. Yeah.
You can type it.
I don't do it as much in the problem statement, but I do in terms of the program that I might be implementing or the methods section. So many of the programs that we might be selecting are ones that we should maybe look outside of the US. So it may be that, if we're looking at, really we're talking about reproductive health, and then maybe, I find a lot of really innovative programs that aren't in our neck of the woods. So it may be that we're thinking, gosh, there's nothing in state that we could replicate. There's really nothing that we're finding nationally that we're excited about. And I find a lot of really cool programs in Canada, Australia, and in Scandinavian countries. And so I have to also think about my audience though. So if my reviewers are ones that I think are a little bit more conservative, and I'm thinking I'm taking something out of the Netherlands around drug prevention, substance use prevention, and they're thinking, oh, the Netherlands, where every drug is legal, blah, blah, blah. I also am trying to weigh that a little bit. Or, oh, they have socialized medicine there, so this can't possibly be a program that has much merit. There's some really innovative, cool programs in other countries, and I try to match them up, saying, all right, for example, we're looking at a program right now, and I mentioned this to my small group, we're looking at a program right now that is around trying to help address mental health needs of kids at different age bands, so age 3 to 6, and then it's elementary school, like 6 to 11, then middle school, and their parents would coach them through an online process where they would have kind of create their own avatars and such, where they would learn how to talk about identifying emotions and then managing emotions. So that if they were, and this it came out of Australia, it was a very specific program around managing anxiety. It's been very successful in Australia. So a lot of it is rural Australia. So I can say this applies to rural Montana, really very similar in terms of taking that rural program and bringing it to Montana so that we can have parents be the very best teachers and coaches to their own children about identifying emotions and then beginning to figure out how to manage those emotions, rather than assume that no one is going to be able to do that, or maybe teachers should teach them how to identify and manage emotions, rather than helping parents figure out how to coach their children. And in the process of doing that, they're kind of coaching themselves by managing their mental health. So we would then use data from Australia that would indicate the success of their program and the kind of decreases they've had in children experiencing, in this case, anxiety. And we would use that data to create a case for our program here in Montana. So I hope that helps. Jessica.
Yeah, no, I think that makes sense. I've tried to write some grants where we tried to pull in some data or some program pieces from other places, but they were all a little bit too tightly tied to healthcare, and that, or involved some healthcare system response or players or collaboration, and that is tricky because just the healthcare systems are so much different in other countries that you have a harder time making a case when you have to rely too much on that. The one thing that I see most times people have to translate from a giant urban setting to a rural setting, like how can you adapt it? But that's actually, funders I've found seem to be pretty open to understanding that if you've got a great evidence-based program that has been tested in Philadelphia, Boston, and New York City, but you're interested in using some pieces of it and adapting it to rural America, it seems like they go with that. So what you've seen in that, Ryan, but.
Yeah, sometimes those programs in larger cities, if you've taken them to a rural area, they may not be a kind of an exact fit, but there may be parts of it that you're bringing into. It may break down its ability to be evidence-based because you might break some of those ingredients out, but it may be that it doesn't fit contextually because the rural environment or tribal community is different. So the folks that we're looking at, rural volunteer firefighters, it may be that they've done something successfully in a larger city, and you may be able to beg and borrow pieces from that and bring them to a smaller area that relies on a volunteer fire department, but you're going to have to sort of say, yes, this is a great program, but it doesn't have an exact fit with the rural area. So these are the pieces we're going to take out of it, showing that we understand our context and how it can be applied.
Yeah. Awesome.
All right, Robin, you want to go
Yeah.
take a look at the budget here real quick? There may be some folks that are thinking about, all right, budgets and what do we do putting these together? I think I talked a little bit about I guess I do now, but having accountants and bookkeepers, I've always had to do it myself and figure it out myself. And I'm sure many of you are having to do the same thing, trying to figure out how to put a budget together. This is a budget example that's listed in the, so that we have a proposal example that includes this budget. So you can take a look at this budget and think about using something like this moving forward, or at least this gives you an example of how to put a budget together. This one is just done in Word in a table. Oftentimes they may give you a template that you have to put the budget in, or you're doing it in Excel, which I'm not as good at in doing it in Excel. But yeah, so this may be something that you might be required to do as well moving forward here, and thinking about what this looks like in terms of putting together salaries and travel and lodging and all the different requirements that are included. So in this particular situation, you can see that they have listed personnel in one section. They've broken out salaries in this particular program. And yeah, stay right there, Robin.
Okay.
That we have this request that we're making. So it's that we're saying, okay, foundation, XYZ Foundation, this is the amount of money we're requesting from you, and this is the amount that we're matching, and this is the total cost. Okay, so let me talk a little bit about match. So we're saying, all right, we're going to request these individuals to work on this project. In this case, I think this proposal has to do with a program in juvenile justice and maybe substance use. And so we're saying we're gonna hire a project director and an assistant director, and we're gonna have a fringe rate of 25%, and then we're also gonna have insurance. They've combined all these fringe benefits into one category. But whenever you're hiring somebody, let's say at that $40,000 mark, you're gonna need more than $40,000 to hire that person. That's just salary. So then we get into fringe, which oftentimes maybe it's 25% or 20%. Let's say 20%. If that's 20% of my 40,000, that's another 8,000 I'm going to need. That 800 a month, I'm usually using a figure now of 1,000 a month or 1,200 a month for insurance. This was done a year ago, so that's how our insurance rates are going up. So I'm really getting at $12,000. So for the $40,000 person, I've added $8,000 for benefits. And I've now added, and this is fringe rate Medicare, workers' comp, what have you, and now $1,000 a month for insurance. I've had $20,000 I'm adding to the 40. So it's going to cost me $60,000 to hire that $40,000 person. So remember that. Now, line right after that, we're going to come up with a match. So it may be that while we're looking into this particular funder, they say, okay, we require you, in this case, to come up with a 25% match. The match is in kind. The match, in this case, is not hard cash. So it's usually a cash match or it's an in-kind match. So it's just basically, what are you going to bring to the table? All right, so instead of us just giving you money, which can happen too, we're requiring you to come up with a certain match. So of your total program costs or your total budget, so let's say, for example, you came up with a total budget of $100,000. This one's going to be more than that. But if it was $100,000, we need you to have 25% of that total project cost be a match from you. So that means I got to come up with $25,000, and then I can request $75,000 from you. So I'm requesting $75,000. I'm coming up with $25,000 in kind for the total program cost of $100,000. So in this case, I'm showing some match, in-kind match, not hard cash, where I'm going to say, okay, we're going to take our existing executive director, or I may even take, if I have a multi-agency application, 3 or 4 different executive directors who are contributing a certain percentage of their time, and I'm going to calculate a total amount that they're contributing to this project. So if I can leverage their time and effort being paid by an alternative source, then I'm going to be able to come up with match that way. I maybe also then come up with a certain amount of match for fringe, because that's a part of the whole amount that's being paid from another source. Then I may have, in this case, an admin assistant who's also going to contribute a certain amount of time. It's going to be salary and it's going to be fringe. And then there may be space, utilities, all kinds of other ways that I can come up with that in-kind match. So whenever you're thinking about, gee, we'd like to apply for this, but we don't have anything to bring to the table. Don't stop there. You probably do. You probably do have something you're bringing to the table. So if you hire somebody to come in, even if it's part-time, and they're underneath your roof, and you have space, utilities, and they're probably people's jobs that are going to have to shift a little bit in order to kind of reallocate their time and effort into this other project. That's also money that and resources that are being put from a different source into the program, this project that you're proposing, that you can count as match. So even though you might not have cash sitting in a vault that's ready to be spent, you have resources that you're bringing to the table that you can count as in-kind match. So don't don't stop when the instructions say we have to come up with a 10% or 25% in-kind match. Okay, let's figure out how to get creative in order to make that happen so that we can become eligible to make that application. So my guess is some folks might have questions about that too. Cash match, in-kind match, those are the two to think about, but there also may be times you have that the funder is not asking for a match. And I have a mixture of both. We have ones where we have been having a lot right now that don't ask for a match. But we do have $1 million, like 1.5 million that we receive, and we have to come up with a 25% match. And it's federal money in that case. So I can't, whenever you get federal money, this sometimes gets a little bit complicated, but we have federal money, 1.5 million. I can't come up with another federal source for a match. So I can't say, if I'm getting 1.5 million from SAMHSA, I can't get whatever 25% of that is. I can't use HRSA as or CDC as another in-kind match source. I've got to come up with a different source because it can't match Fed with Fed.
So Ryan, what you mean by that, right, is you couldn't count like 20% of the time of somebody who's actually being paid by CDC to pull in.
That's right.
Right? Yeah.
That's right. Yep. Because now I'm matching federal dollars with federal dollars. I can't do that. So I have to come up with it somewhere else. So I can come up with it. Maybe it's through donor dollars or it's state money. So I'm using a lot of state money to leverage federal dollars. And this is an argument I'll make oftentimes to state folks is they'll say, well, we can't apply for that because we don't have the match. Let's find the match, because if we can bring $1 to the table, we're going to bring $3 in. So this is a good investment for the state of Montana, or could be Colorado or Tennessee. This is a good investment. So why wouldn't we figure out how to make that $1 appear so we can bring $3 in? This happens with Medicaid and all kinds of other funding sources. There's no investment that any of us could make right now with our own personal money where we're going to be guaranteed to put $1 in and get $3 additional dollars back. That's a great investment. So how can we figure out how to do that in order to bring in those or leverage those federal dollars? All right, so the question that's came up here is from expected revenue, not from money you already have. Yes, so you can do that. So it's sort of like, this is what we anticipate. So the budget is what you're anticipating the estimated cost of the program will be. So it could also be that we're anticipating that we'll have this money that will come in and we'll use that as a revenue source. I would make explicit then in the discussion that this is what we're anticipating as revenue that's coming from whatever it might be, donor dollars, or it could be some other grant we might be getting, or we're on the last stages of. So you could even get that other donor to write a letter saying, yeah, we're going to be funding this. The money isn't in the bank yet, blah, blah, blah. Great, that becomes our match source. So yes, you can do that based on what you're anticipating. Now, here's something else that I've done before is I'll say, all right, how about we do this? I think for this project, I'm estimating I'm going to get 25 volunteers. And I'll say, I've done this at the federal level. I'll say, I'm estimating that I'm going to get 25 volunteers for this. I'm estimating. I'm thinking, oh man, 25, that's a lot, but I'm thinking 25 and I'm going to get 100 hours out of each of them. So I take 25, multiply by 100, I got 2,500 hours. Now I'm going to multiply it by, and I've cleared this with the feds before, I'm multiplying it by, I think I was able to use minimum wage. And so now I'm saying 25 volunteers, 100 hours at minimum wage, this is going to amount to, let's say, for example, hypothetically, $10,000. I'm using that as a match because that's what I'm anticipating I'm going to get as a result of starting this project through volunteers that will be a part of it. I've been able to do that in the past. I don't know if that has changed. I've done it with other grant funders as well through foundations, but that's one in terms of what I'm anticipating that I might be able to use as match, not having it guaranteed, that you got to kind of get creative in thinking about, but it's part of your total program cost. Instead of me hiring somebody with that number of hours, I'm going to have volunteers that are going to do that. That's a good utilization of resources. and it ought to be included as part of the total program expense. Emily, I think was saying that maybe there's another question here too.
Yeah, I think back when you were talking about you can't match federal funds with federal funds.
Oh yeah. Yeah, so I think Lauren wrote, is this just a federal restriction? I know it's for sure a federal restriction. There's so few state grants that are allocated because the state, at least the state of Montana, we don't have that much money, it seems like. So there's very few state opportunities. So I don't know if the state would allow you to use other state dollars if state money came in. And I think it would be on a individual basis. So it could be if a foundation required you to come in with a 25% match. So you ask them again for $100,000, you need to come up with $25,000 in kind. Can I use state dollars? My guess is the foundation would say yes, you could use state dollars, that would work well. I don't know if you got it from the state, whether you said, well, we have these other state dollars that are coming to us, can we do that? I would ask them, or look in their instructions to see whether or not you could. And that may be a question to ask early on so that you don't get too far in the writing process and go, oh, I assume that. Don't assume it. Ask each of the funders that you're dealing with whether or not that is a possibility to use foundation as a match source, or use state dollars as a match source, or use feds. But do know that Fed to Fed is not possible.
And that it's actually very important if you're thinking about hiring to make sure that somebody from whoever does your HR services, you know, or your administrator, or whoever's going to be doing the hiring and manages that bigger overall budget, that you get them kind of pulled in quickly to make sure that you get the numbers right and you get the okays and all that stuff too. So especially if you're a union, you have to match up with that.
The other part of this too, I think Kate was talking to me a little bit about the folks that were talking about firefighting and bringing in people and fitting gear and all this other kind of stuff. And what would some of the expenses be related to consultants that might come in, or trainers that might come in, or fitters, or whatever they're called. That may be part of a contract service or contracted services. So you have an independent contractor that comes in. In this case, we're showing evaluation as being the contractor. So it would be almost assuming that the funder saying you need to have an independent evaluator and you need to take X percent of your total budget and put it aside for evaluation. Sometimes it's small, sometimes it's large, but they may require that. The other contracted services may be, in the firefighter example, we're going to bring in the people that fit them for suits. We're going to, okay, do it. We got to have people that help train them to use the equipment. Perfect. Put it in there as contracted services. You need it. Again, as I mentioned earlier, don't go on a cheap end of this. And this is coming from a guy who's done it. And so I would oftentimes be competing against, I'm thinking, oh, I'm competing against all these other states for this money. I'm going to develop a proposal that's going to be really fiscally conservative. And that may increase our likelihood of getting those funds. So instead of travel dollars, as an example, I think, we don't need $10,000 in travel. Heck, we can take the bus. That's the way my brain thinks. This is very unfortunate for my wife of 25 years. We can take the bus, we can hitchhike. God, yeah, hitchhiking's still so safe. All right, no, that's not a good way to think. So instead of saving $5,000, ask for the money, all right? And make sure you have it. So that if I hire somebody for that $40,000 or $45,000 amount, they come in and they say, I'm getting paid well. I like this job right from the beginning. Rather than saying, well, as the guy, again, who's writing the budget, I can save $5,000 or so by bringing him in at 35. Well, then I don't have a person who maybe is fully committed because maybe that their salary isn't equitable for what the job requires. So why don't I pay him as much as I can to get a really good person who's coming in at 100%, energized about this position, excited about it. And then I'm also giving him or her travel money, so I'm not forcing them to hitchhike or take the Greyhound bus. And so when I have done that, other people have not done that, and we've all been funded. We all are funded for what we requested. Okay, I requested too little, they requested the right amount, and their people are happier. So I'd rather have people happier who perform well because they have the resources they need. So again, firefighting example, whatever else it might be, ask for what you need in order to do this successfully. And there are times I might think, 10,000 for travel, God, it seems like a lot. Probably should increase it because I know I think cheap. I probably ought to even make it a little bit more just to make sure we have enough so that we're able to be successful with the program. Huh.
So we got 20 minutes left, Ryan. Do you want to move on to resources? Do you want to finish up on the non-personnel stuff, or?
No, why don't you go ahead and take a look at the
Okay.
web page. One thing I'll say about equipment and supplies is that you oftentimes have to break these up. So supplies are going to be, I don't know how many people use paper anymore, but paper and other kinds of things like that. Equipment may be challenging sometimes because you have equipment purchases that may be restricted in some ways related to computers and printers that may outlive the time period of the grant. But if you need them, get them. You know, you've got to have it. It's an essential tool. Make sure you put it in your budget.
And remember to put, like, if you need to get additional, if you need to pay for additional computer sets, the software that your office uses or something too, I've forgotten that in grants. And then that's suddenly like a $500 cost you have to eat, which is not fun. All right. So the resources we have that we've mentioned several times this morning already are on our website. It's on the University of Montana Center for Children, Families, and Workforce Development. And one of the first things we have is the dashboard. Ryan was the one who brought that up. We have just a little bit of information about it and how to use it. But mostly what we have is some great stuff in these different categories. And, you know, and this is constantly under improvement too. We're working to make it better all the time. So you can expect to see good stuff keep coming. And recently the feds have changed a lot about how they do some data collection. So we're having to redesign this site a little bit as well. So it'll be undergoing some changes in the coming year or so. And some of the issues we have are that just some of the data years are long ago, but the nice thing is that we can get some stuff county by county. Let's see if I can, so you can, let's see, I'm trying to think of where we will want, let's do Silver Bow. So what you do is you can click on the county and then you get the trend data for whatever you want. And it shows you here, this is where you can get the specific numbers by just hovering over. Lots of different categories. You know,
Yeah, I think we have like 110 different categories here or something.
yes, something like that, yeah. And so you know, within families, you can look in this way. So this is worth just kind of like getting in and poking around and seeing what you can find. And, you know, we've tried to, as much as possible, have, you know, something on everything, you know, that so much stuff, like when you say like you're getting data about children and families, you're getting data about almost everything, honestly, because there's just so much stuff that affects, you know, that whether it's economic or housing that affects what's going on with families. So this is our data website.
Yeah, and there's a question I asked Robin about, we're in the process of updating it right now. And so we have multiple data sources that we go through. And so that is forthcoming.
Yeah, it's kind of, we try to update it regularly, but because of some of the changes to federal data, it's that we're kind of having to come up with a bit of a new system for it. I'm not primarily responsible for the data updating, so I don't know the full story. I just know that stuff is happening. It's kind of constantly under looking at and being updated. So working on that now.
And one of the reasons we created this was that we knew across Montana that people were spending a lot of time collecting the same data, to make the same case for a proposal or for reports or whatever else they might be doing. And it's just a lot of time wasted that we thought, well, we looked at other states and saw some really cool ways that they organize their data. So why don't we do this for Montana so that instead of you having to reinvent this every time, then somebody, you know, down the street reinventing it as well, let's have one place they can go for this data. So you can sort of swim around in here forever, but find a lot of different variables that will allow you to understand your region or county better.
Yep. And if there's stuff you really wish you could find and it's not here, because there's lots of holes that we'd like to fill, let us know, because, there's always we're trying to create a list of, kind of what we know people want out there and we'll tackle that first. All right, so that's the data resource we have. And this is the one I work more specifically with, is the grant resources. So there's a little toolkit for grant writers that's kind of like a very mini class like this. One of the benefits that's just a self-paced online for beginners mostly. If you have, the one really nice thing about this is it's got some examples of different sections of grants that are more federal grant related. So that would be a place to look for this place right here for some grant samples. We also have some more resources for where you can get grant information. There it is, the Rural Health Information Hub was one that we talked about in my group. It stays pretty tightly tied to healthcare and health systems in rural communities, but it's very specific to rural. So they have a really good notification system for grants. It's worth taking a look at. Here's the 990 finder I talked about earlier. And then of course, grants.gov. But you can also look here. We've put together this. I get lots of grant opportunities, and we've all realized how much time it really takes to sort through them, because there's just a lot. And sometimes you'll look at a grant and you're like, wow, this looks fantastic. And then you'll read that it only works in the Mississippi Delta, or it's only for places that have a certain department store has a store in your community or something. So I thought, well, I could take away a lot of the pain of looking for grants if me and a couple students are kind of like sorting through these things and putting them up for people. They're divided into local, tribal, public health, and statewide grants. The statewide grants are mostly just the bigger grants. And if a grant fits in 2 or 3 or 4 of these of these areas, it's in all of them. I don't make you go search through every one. So, and tribal tends to be the biggest, because there's some grants that are very specific to tribal, but then they also fit all the ones that are for rural or small communities as well. And then sometimes even the bigger ones that the state is also could apply for. And some of these statewide grants too, it doesn't mean that a regional collaborative or something couldn't apply for them. They're just a little bit bigger. They're bigger grants and are often a bigger lift and need a little bit more infrastructure which is what makes them statewide. And these are the documents that I routinely share with the state. But we'll just look at one really quick so you see what it is. And I've gotten here 2 documents. One is the current grants, and then the other is the past due grants, meaning they're done, but they're they're nice to look at because you can see what has been funded, and that's where you can find some of the funding sources. One thing that I think is kind of confusing is that I have 2 different grants. One is a long table of upcoming grants that are in date order, and the other one is grants that you can apply for at any time. They're just a rolling deadline. I think I'm going to make that a separate grants table because it's starting to get lost. It's too far towards the end. But that in particular has a lot of smaller grants for things like community gardens, or so that's where you can find some things to buy some of the equipment for different programs, stuff like that. So or supplies. So let's see if I can make this bigger. And so right now, this is kind of a weird thing. Usually I wouldn't have ones that don't ongoing grants on top, but right now it's all COVID ongoing grants that are on top of this, because I want to make sure people know that there's some grants that they could apply for right now. And just put in for the money. And that doesn't count the stuff that's through the state. It's different than that. But then most of the table looks like this. So this is the one, there's a few that are due today. So they'll move off of this table by the end of the week. But, and I, again, try to cast a really wide net, because you never know when this National Endowment for the Humanities, that there isn't some local group that really that has been looking to do some art project as a part of a youth health initiative or something like that. So, or a community kind of rallying event or something. So I've just started putting it all in, because you never know what people are going to be interested in. And I've hopefully made it so that it's really fast to look at, so that you can just you get the main stuff out of the way, knowing if it's something you're interested in looking more into or not. And this is the link over here in the title and link, so that then you can go to the information and just, learn more for yourself. So it includes everything from the big ones like HRSA, and then like little grants like this Honor the Earth grant, which is $500 to $7,000. So it's kind of all over the map as far as amounts and what they're for. But there's a lot of stuff there, and hopefully it can be a good place to start looking for stuff. And it's the kind of thing, if you just schedule it in to take a look at once a week or once every 2 weeks, if you're looking for grants, you'll see the newer stuff that's come up. Gosh, any questions about that? I don't think I have anything more I can say about that. Ryan, can you think about it? Oh, here's the thing I really need to say, which I've mentioned a couple times, but we do want to help you build your capacity to apply for grants. Specifically, I mean, we help the state, but we specifically want to help communities or collaboratives or rural areas or tribes or whatever it is find some grants. So we can help you find them. We can help you with certain parts of the writing. We can help you do some of the planning and the budgeting. We can provide whatever, we'll do our best to provide whatever kind of help you need. We really would love to see more of this kind of money come into the state of Montana, because I do think that Montana is underrepresented in many of these, for many of these funders. And I think rural communities are really, really underfunded for a lot of these grant opportunities. And I think that a lot of the funders have been realizing that, because several of them are even say it's like rural, they will call out rural communities as people that are eligible for the grant. So I think that I think that people want all of our rural communities to apply, and we would love to help. So I think that's it. Ryan, you got anything else?
I don't think so. It looks great. It's been a while since I've seen this. So
yeah, it's gone through a few different, I think we started putting it up in November, so it's still pretty new, and we'll continue to develop to meet needs. See how that goes. All right, I'm going to go back to the slideshow then, because I think that we are just on our wrap up for the next 7 minutes.
I'm going to check and see if anybody, we've been here for like 4 hours now, and I know everybody's got, probably their eyes are crossing, and it's like, okay, we've got to look at something other than this screen and certainly hear somebody else's voice besides mine. Anybody have any questions that we can answer before we wrap up here?
My screen is not wanting to share. Why?
Questions at all? Anybody can think of?
Don't be shy. They don't bite.
Ryan bites, but I don't.
Okay, ask Robin.
As Robin mentioned, we are here available. What our agency does basically is try to help solve problems that affect children and families. So we're trying to figure out ways to leverage resources and opportunities and build infrastructure for systems that are working with children and families in the state of Montana. So when there's a problem that's been identified that affect children and families, we are trying to figure out how we can help you out in local communities across the state of Montana, figure out how to best address that need. And so we know that there are many people that may not have the time and energy to do all of this that we're doing. So we've watched other states do this to create this resource so that we can provide this for you folks out in Montana. And those of us in Tennessee, Colorado would be certainly willing to help you guys as well as you figure out how you might move forward. So anything that comes to mind, we're not going anywhere. You can email us, ask us questions so we can help you move forward in whatever problem or issue you're trying to address in developing a grant. As we talked about today, make sure that you are thinking about, as you set up this grant writing process, how to convey a compelling story using objective data, figuring out how to bring in team members to be a part of that process. How do you get to understand your audience and those that are your potential reviewers in order to assure that you are in direct alignment with what they are looking for in terms of funders and investors. And any way that we can help you formulate that argument and collect that evidence, that data, in order to address those problems in Montana, please let us know. And whether you make your way through our webpage or through Emily or through Alexis, we're available as needed in order to assist in that process.
Also, this is a question I get asked all the time when people contact me and say, it's like, okay, well, if you help me get this data, how much does it cost? And it does not cost money. I mean, there's a point at some of the evaluation stuff. If you're going to roll us into your grant to do stuff, we're not charging people. So.
Awesome.
All right. Well, thanks everyone. Sure
Yeah,
appreciate
thank you
it.
so much.
Thank you. Yes, I have an evaluation for you all, and I'm putting the link in the chat box. So feel free to fill that out now. We certainly love to get your feedback and use it for our future trainings. I will also email it out, and I will send, this is being recorded. I will edit it down, and we'll post that as well. So you'll get an email regarding that, so you can revisit it if you'd like. So thank you so much.
Lovely. Thanks,
Have a
everyone.
great day.
Thank you.
Bye-bye. Thanks for sticking in there.